Dear Pure Urology viewers, good evening one and all. As you all know, we are either alternate day or daily discussing the surgical technique based presentations. Exactly 1 year back, because of the corona pandemic, I got this idea so that we can get connected across the world, primarily focused on surgical techniques. Today is first year anniversary. I am very thankful to Professor Dr. Chinna Swami sir today accepting for the guest speaker. Though we are not discussing any surgical technique, I have put the name as work-life balance. If we remember younger generation, all of us, there are two reasons why we take urology. One is it has diversity of the branches where you can go to whichever the department you like, whether endourology, kidney transplantation, andrology, etc. Second thing is, I don't know whether I am correct or not, we all feel that there are less night duties, less emergencies, so then we can have quality of life. This is not the discussion even though, but quality of life is very important whether you work for 12 hours, whether you work for 15 hours, whether you work for 8 hours. The seniors, we think that they don't have competition, but they have something else problem. That something else is lack of technology that time, lack of communication, lack of training, lack of advanced science. But due to having lot of patients, they have to treat them. One surgeon used to treat more than 100 patients per day, and they have to give better outcome. And there is no doubt 30-40 years back, the discipline of urology, pathology discussion, clinical discussion, outcome discussion, paper writing was still there. Except the gadgets, all the brains were there. Dr. Chinna Swami sir belongs to that era where yesterday I came to know that he is the first official MCH urologist of the India, and he is about 90 years old, and today he is joining for our discussion. Very fortunate moment and very appropriate decision by me to do it on the first year anniversary. His friend Professor Venugopal sir has joined to witness the program. He will be happy to listen. He himself was asked, and we will interact and share some of the moments in their life. Every person has to pass through these phases. One has to become old but be younger at heart, but sharing the memories and experience like our father and grandparents, what they share about our life and guide us. These professors have guided and still guiding. That is a fortunate part. So I will ask Chinna Swami sir a few questions before we take up. In fact, today is our anniversary, so I already posted, so I don't want to waste much of the time. Directly we will go with interaction with Chinna Swami sir. Chinna Swami sir, good evening, and I thank once again for joining.
Thank you for the invitation. It is a pleasure to see Dr. Chandramohan.
Yes, sir. Sir, before I ask you, I wanted to share a fine moment. In 1997, after I passed MBBS, I got some 10th rank in my state. I wanted to take pediatrics. My father wanted to take surgery. So my father has taken me to Chennai in Vijaya Hospital because your brother is very close friend of my father. So you told that why you wanted to go for other than surgery. Surgery has charm. If you are really interested in pediatrics, go to pediatric surgery. So way back when before my surgical career started, my father with that vision has taken to 2-3 urologists. One among them is you. I am very thankful that you properly guided. As you said, today I am doing pediatric endourology stone still is my focus, and I am very thankful to that, sir.
Yeah, good.
Sir, when did you start your MBBS? Which year you joined the MBBS and which college, sir?
I started MBBS in 1948, Madras Medical College, as a intermediate student. My batch was the first one to join MBBS track. Before that, they had to do a pre-registration of 6 months. From my batch, it was a direct admission into the MBBS. It was 1950.
What is the history of Madras Medical College, sir? When was it actually built by whom? Briefly, who has built that Madras Medical College?
Madras Medical College started as a Madras Medical School 150 years ago. Before that, it was a hospital mainly meant for army people. Then general public were admitted.
It is one of the oldest medical college, no, sir, Madras Medical College.
There are 3 medical colleges which are as old as the medical college. One is in Calcutta, other in Mumbai.
This is primarily built by British people, sir.
Pardon?
This is primarily built by British people.
Yeah, started by the British East India Company.
So your selection criteria was just intermediate exam based marks.
Yeah, intermediate examination mark. There's no interview at that time. It was only by the selection committee which selected. Actually, district war quota. It was a big state at that time. Andhra Pradesh as well as some districts in Manipur and Karnataka were part of the Tamil presidency, and each district had some quota, and I was selected from Salem district quota.
You are selected from Madras district or Salem?
Salem.
Your father belongs to Salem.
Yeah. I am still called by Salem doctor by many.
Yes, sir. Your brother also we remember as Salem tennis player. I don't know whether you played tennis or not. Your brother is remembered for your tennis. I hope he is watching the program and your family is watching the program. And when did you get married, sir? If you don't mind.
Pardon?
When did you get married? During your MBBS only?
Can you repeat the question?
Sir, when sir got married, Ramesh is helping Swami sir's son. When did you get married?
There was some disturbance, Chandramohan. We could not hear the question properly.
When did he got married?
When did you get married?
19? When, sir? You have forgotten.
He thinks he got married in 1956.
1956. Okay. During your MBBS, who are the teachers you remember, sir?
Among the surgeons, Professor Manlal, Professor Vishwanath Menon, among the physicians, Dr. Ratnavelu Subramaniam, Dr. Pai, then C.S. Sadasivam was a surgical registrar, very popular man. Professor Venu was a honorary assistant physician at that time.
During that time, where all these surgeons got training? Where did they get training?
Most of them got trained in India itself, in general. Few of them abroad, not for training, after training for some years of work. There are 1 or 2 FRCs. My chief doctor, Dr. Vishwanath Menon, was an FRCS. Like that, even those people did their MS master surgery and then went on to have.
So after that, you joined MS General Surgery in which hospital?
In Madras Medical College, 1955.
1955. Then when did you join MCH Urology then?
MCH Urology, I went to UK for higher training in urology, returned, and then the MCH course was started at that time in 1964. 1963-64 is where I started the MCH course.
Do you have any extracurricular activities during this period of training?
Yeah, I was also trustee of the medical relief wing of the Madras Medical College. We used to go to a small village every Sunday and they give some treatment there. That was one of the other work I had. Professor Venugopal was the chairman and I was the treasurer of that. We used to go to the medical relief. Apart from that, nothing much to say.
Are you a player? Any tennis player, shuttle, or anything you used to play?
I used to play tennis in the hostel and even won a medal as a junior doubles player. Now
You are
I used to play badminton as well as tennis in the hostel.
in the hostel. And what was your father and mother at that time when you are doing MBBS?
Well, my father is a textile businessman, cloth merchant in Salem. My mother was a homemaker, looking after a big joint family of five brothers, five of my father's brothers. It was a big joint family. My mother used to look after.
So it's a combined family, and mother used to work hard and father into the business. Uh,
Yeah,
yeah, great. So after joining MCH, what were the main surgery list during the 3 years you used to have? Open ureterolithotomy, nephrectomy. What are the common surgeries in the training period? Who was your HOD?
HOD was Professor Venugopal. He was the one who was responsible. Huh? Professor A. Venugopal, not P.
Yes, yes. Yeah. Dr. P. Venugopal is in front of us. Dr. A. Venugopal is a well-known person. At the end, we will take few words from Venugopal P. also, because today Chinna Swami sir will speak, and at the end, Venugopal sir will address the concluding session. So your HOD was good in which subject? Like he was general urologist, used to teach everything. What was his character?
He was a haunted general surgeon in Government General Hospital. He took special interest in urology. When I returned from training in urology, the urology department was started and he took a keen interest. It is of his interest that the MCH course was started in Madras for the first time in India. His father, Dr. was the Vice Chancellor of Madras University. He had go on hunger fast, making him to start this MCH course. At that time, MCH course was started in 4 subjects: cardiothoracic surgery, neurosurgery, and plastic surgery. These were the 4 in MCH at that time.
So after the MCH, when did you go into private practice, sir?
After retirement, before that, you see, in Madras government service, you are allowed to have private practice.
So you worked in Madras Medical College only?
Yeah, government.
How many years you worked, sir?
Maybe
25 years. 25 years?
Yes, 25 years.
During that time, evening private practice where you used to go to hospitals, roaming practice, or just go to one hospital in the evening?
Two hospitals mainly. One was Vijaya Hospital. The other one was a few hospitals in Chennai. Isabel.
Vijaya Hospital, quite a long time you are there. Quite a long time.
And since the hospital started, it's in 1970.
50 Golden Jubilee now.
Golden Jubilee.
Golden Jubilee now. Very nice. So I think you are one of the early founder members in departments in Vijaya. I remember we came to Vijaya actually in 1974. In 1997. During your private practice, do you used to get assistants or you have to do yourself? Who used to retract the abdomen? Who used to help you all those open surgeries, particularly nephrectomy, ureterolithotomy?
Most of my one or two assistants to the general hospital used to come and assist. The main thing, they are all become big people now. One in Shivashankar in Bangalore, Dr. Balakrishnan in Coimbatore, Dr. Tirumala Swami in Coimbatore, and late Dr. Chandrasekharan These are the few people who assisted me for quite some time in Vijaya Hospital.
During these times, who are your contemporary, close contemporaries? Urology contemporaries in the India. I mean classmates.
In Mumbai, if you say Ajit Patke,
Yes, sir.
Delhi, Sardar Mohan, because he was senior, he was my examiner also. Others were quite junior after that.
Who is that? Who is there? Who is in Delhi?
Sardar Mohan Singh.
Mansingh. HOD Ames at that time, I think Mansingh, sir.
He was my contact. And in Chandigarh, Dr. Bapna.
Dr. Bapana.
In Jaipur, Gangwal, K.C. Gangwal. He was another urologist of my time. He also had a lot of problem in starting the urology.
Okay. So when did you become Urology Society of India president?
It was 1956-58.
56.
President 56. No, 86. 86.
1986. 1986. So during your president times, how many urologists were there in India? Roughly. I am not too much troubling you asking these numbers. Just to recollect what has happened decades back.
About 200 full-time urologists were there by the time I completed. Now it is 200 at that time. Now
It is 3,000 now. 3,000, 4,000 it is now.
Chennai has 300.
Chennai itself has got 300 urologists now.
Yes, sir.
More than 40 postgraduate trainees in Chennai itself. So it's a big thing.
So
It has grown.
it has grown massively. At that time, what was your timings of work when you are between 30 to 50, 60 years of age? How many hours you used to work, and what is the working time? See, our topic today is work-life balance. I am slowly entering into that. How many hours you used to work?
See, we used to, for private, we had to go before we start the work in regular. So you start the surgery in private hospitals by 7 o'clock and then finish the work in general hospital by 4. Come back home, have tea probably, or go straight to the nursing home. There work till 7:38. So it's about 12 to 13 hours a day.
Chandramohan, can I?
Yeah. Yes, sir.
Yeah, I know how much he used to work. We, as a small children at home, never used to see him for 2 or 3 days. He would leave before we wake up by 6 o'clock to do his case hospital. And he will come home probably before we came home and then go to the evening practice. And if he is delayed in the clinic, we will not see him at night. And he would have left the next day morning before we wake up. This used to happen.
How many children, siblings you have, Ramesh sir?
I have an elder sister.
Okay.
She is in US. I have a younger brother who's currently a dean of dental college in Chennai.
So
We are 3 of us.
Very good. You are also in Vijaya urologist.
Yes.
Yes. And
He didn't include my name in that retractors.
so he used to retract also. And he said all the trainees under him. You are also trainee under him.
Yes.
Nice. So, Chinnasamy sir, one honest question I wanted to ask. When urologists are growing, when you are in private practice, how was the competition? How was the jealous? How was the open-minded discussion? How was the interdisciplinary domination? And how was the urologists projecting themselves as the best? How do you take these type of stress in your life? Did you ever bother, or you used to be cool, or you used to get anger, or you used to get sleepless nights during active practice? Honestly, you share your opinion, because now youngsters say that urologists are too many. It is very difficult to practice, even difficult to earn money, even difficult to survive. And whatever surgery, they are not getting that many cases, and they have to do freelancing practice too much. I feel the philosophy of life is same at that time here because human nature is same. So you share your experience. What was the competition defined at that time? Do you try to excel because you are the first MBBS in Madras Medical College, you are MS from Madras Medical College, you are the first MCH. Naturally, you will have some drive. Any person who has drive will have competitiveness and jealous also. So what is your take as far as personal life is concerned when you go back home?
As far as the competition is concerned, I think my only senior was Professor Venugopal, and I used to work with him also at times. But other my colleagues were all quite junior. Even though there were service senior people in the service, there were so much of cases available. There was no need for any competition at that time. So it was okay to do practice. Not many people were doing endoscopic surgery. Doing TUR in private practice, there are very few people at that time. So
I heard that you are the one you used to do, but of course there was no camera to watch. So you have practiced without camera for a long years.
quite a number of years. Actually, to tell you, when I was in UK, I was there for more than 2 years. First 6 months I spent in London, Institute of Urology. Nobody was doing TUR.
Yes, sir.
Dissectoscope was not available. And I went to Edinburgh.
Yes, sir.
David Van had a dissectoscope imported from US. He was so proud to own it. It was made by UCMI. He used to do dissection only for carcinoma prostate, make a tunnel. He will do 15, 16 cuts, and he will see that the assistant brings out all the 16 and spread the 40. The other resection was done in Newcastle by Swami. He used to have a cold punch, a very sharp tubular knife with which he used to cut the prostate and then used that able to. Otherwise, in London, there is no transurethral operation at all. That is, when I came back to India, the earlier had a urinary retention, and for him, American urologist came and did a TUR. It was the first TUR probably done in Chennai. From then on, it grew. They were doing TUR in CMC Hospital, Vellore, and Professor Venugopal TUR in Government General Hospital. So there is a competition as far as prostatic surgery is concerned. Before that, all of them doing only Friar's operation. You put a finger, then you plate, and then pack the wound with gauze, ribbon gauze, or sometimes even leave a ribbon gauze for 24 hours and remove it next day. It was always touch and go. Many people survived the surgery. It was okay.
Yeah.
Then it grew.
So who trained you this TURP then?
It is only by looking at Dr. Venugopal periodically.
Surgeries.
Surgical.
Venugopal is also a very good surgeon. A Venugopal is also a very good surgeon, open surgeon.
One of the best surgeon and good orator also. A gifted man. He was good organizer.
He was good orator also.
Good organizer. He is, apart from being a honorary surgeon, he spent more time than many of the great surgeons in the hospital, and they had public interest. As I told you, he was chairman of the medical relief wing. He organized so many. He was a secretary, honorary secretary of the Association of Surgeons of India continuously for more than 20 years. So much
My
of
God.
yeah.
Okay. So you have never deviated from urology like that?
Pardon?
You have never deviated from urology like that?
That's what I said. Some work like medical relief wing, and then I had some activity in Rotary. I had been a Rotarian for a number of years. I started a Rotary club opposite to Vijay Hospital called Vadapadani Club. That was the other pastime.
So till what time you actively did surgeries? Up to what age? Are you are doing now also?
Now Ramesh is not allowing me to do surgery.
Otherwise, you are interested to do.
Not very keen now because I find that I'm not so steady. I can do some system, some dilatation. What removals are the one I am allowed to do.
What is your favorite surgery when you are in peak practice?
You
TUR,
Myeloplasty also we used to do myeloplasty.
pyeloplasty.
Organized urology in a big way. We organized first PCM shop in Chennai.
Yeah.
People are not years ago. We had one of training who was working in Minnesota, Dr. Pratap Reddy. He organized, he did his best. But only thing in America, the PCM picture is done by a radiologist.
Yeah, sir. Puncture.
He brought one professor of radiology, Castaneda, all the way from America. We had a big crowd waiting in Apollo Hospital because they were the image intensifier was available at the time. He took one full morning to do one PCM puncture, and then we thought this is not a practical thing. We almost gave up. Then within a year, a youngsters team came from Germany all the way, and they demonstrated 5 PCM in one session in Vijay Hospital. That gave us some courage, and then we started PCM.
Very good. So, are you in connect with your brothers, Natarajan sir, and other people now also?
We
Do you
are,
talk regularly to your brothers?
we are 6 brothers. One passed away 2 years ago. My eldest brother is a retired physician. He lives in Chennai. We have contact. The other 3 brothers, one is in England, one is in America, a retired surgeon. I am in touch with the other 2 brothers in Salem. I periodically talk to him. Actually, I talk to Natarajan every day.
Yeah, Natarajan is from my childhood encourages me. He is like my father figure. He used to come to my house, and he is in same textile like my father. So both of them are very close. He's very thin, lean person and very good tennis player, and he's very healthy person. Wish he also will continue the same journey. And with this, I will open the PowerPoint presentation and share some photos, and then we will ask Venugopal sir few questions about you. Today is your day. We made our day because it's a continuously we have done a year or so. We wish we wanted to continue with these surgical programs. Rajendra. PowerPoint presentation we have to open. Share screen. Where is the PowerPoint? Why it
And
is?
came to Vijay Hospital asking about selecting urology. I thought that the big institute will come up in Hyderabad one day. Good.
Thank you, sir. You made one of the few persons who encouraged me to do that. Stop sharing. We are trying to share the PPT.
Sharing this.
If you heard about the lithotripsy, When I went to UK sometime,
Yes,
I
sir.
saw Tripsy there. There was a big water bath where the patient will be immersed. And they used to have a big ion-filled water, and most of the machine and all was so high. I thought it was not possible to start without
Yes,
Tripsy.
sir. Are you seeing the screen, sir? Yes.
Yeah, I can see.
So, dear audience, I am happy that we have taken 157 speakers. Today is the 158th speaker, Dr. Chinnasamy sir, on the eve of pure urology. Last year, 24th of this month, we started with Dr. Ravindra Sabnis, who is the President Urology Society of India, and now today, Dr. Chinnasamy sir. Various faculty from national and international, and we also wanted to start a phone number where we can ask for any suggestions, we can take help from others. So we want to get connected, those who are shy to express in the Facebook group, or who doesn't want in the Facebook group and still want to share. We are from today activating this number 8674 888 8674 So we had 157 talks, 7,903 followers, 9,600 subscribers, 3,21,000 viewers, and this is the largest group of the Facebook now in the world. So the pure urology is made. This talk is by Dr. Chinnasamy sir today, and to officially introduce, he is the professor and head of the department of Vijaya Hospital Institute of Urology. Had urology training at Institute of Urology London, Western General Hospital Edinburgh from 1961 to 1964 under Mr. David Brand, and from 1964 to 76 under Professor A. Venugopal, which we heard that is a orator, a great personality and great surgeon too from Madras. Joined Tamil Nadu Medical Services and worked as assistant professor surgery and later as reader, associate professor and head of the Department of Urology at Madras Medical College and Government General Hospital. Organized renal transplant program for the first time in the state government hospital in India. Started shockwave lithotripsy until as a cooperative unit of urologists in Tamil Nadu. Examiner for National Board of Examinations in Genitourinary Surgery and in MCH for many reputed universities. Recipient of Urology Gold Medal of Urology Society of India. Past President of Urology Society of India 1985 to 86. Was syndicate member of Annamalai University and advisor for Sri Ramchandra Medical College and Research Institute, that is deemed university for Porur, Chennai. And the some of the memories we are recollecting here was sent by Chinnasamy sir, and here Chinnasamy sir, you can speak. This is Nagireddy Memorial Urology Oration.
Yeah.
Who is this B Nagireddy sir? I think he is the founder from our place, my native place, Tadipatri. He is the founder of the Vijaya.
Founder. Yeah, but
Nagireddy is he's from Andhra. I don't know it is.
Yeah, sir. He is from my native place. If because we used to talk with your brother, and many times we recollected. He is the one of the Vijaya Hospital. One of these things, no, sir.
Yeah, Vijaya Hospital is one. Vijaya Studios.
Vijaya Studios, and this is Urology Society of India program.
No, this is specially organized by the Madras Institute of Urology.
Yeah.
We conducted annually this Nagireddy Memorial Oration, and
I could see Dr. Mahesh Desai sir, Christian Chause, Rajashekaran sir, and NP Gupta. I don't know who is in between. White shirt we are missing.
must be Nageshwara.
Nageshwar Rao. And this is the Androcon conference in 1997. Professor Pinnamalin Nageshwar Rao sir is the photo, I think. And this is the pic of yours in 1978, as Venugopal sir mentioned just now. Probably you are at the best in your career with this photo. This is a very precious photo of 1978. I don't know how many can recognize the seniors watching the program in this. Dr. Chinnaswamy sir is there at the extreme left in the front row. wearing the tie? You always wear the tie.
Well, conference, everybody was in a suit. And I was only wearing, I didn't have the jacket at that time. I didn't wear it. But from here I could see there are many people are missing, in the sense they are gone. Venugopal, you can see him right next to.
Yeah. So it is very difficult to. Next time we have to make some names so that it will be. I can see the Vadva sir in this photo because SN Vadva sir I know. He is on the second row. Anyway, that is a great memory photo. This is actually sent by Venugopal sir P from Mangaluru yesterday, and then I added great memory photo. This is fortunately from Hyderabad, where organizing secretary is Ranganath Rao sir and joint organizing secretary Dr. B.V. Ramaraj sir, and both of them are very seniors maintaining the decorum of the Urology Society in the Hyderabad. B.V. Ramaraj sir is now around 80 years and is very active playing tennis now also. And this is a photo, sir.
This is taken on the eve of my retirement from Government General Hospital. You can see Dr. Ravi Shankar by my side, and on this side is my wife, Dr. Ashok Kumar, retired professor, Dr. Swami, Dr. Sankaran, Dr. Dharmarajan.
Very nice.
Dr.
This is a photo from your hospital.
Inauguration of Lithotripsy Center in Chennai. After I retired, in a time or so, we started this Lithotripsy Center in Chennai.
5 years after.
5 years after retirement, okay. And number of my colleagues, urologists joined, and we started this lithotripsy unit.
And this is?
This was done in Salem. This is what is written here is a trust in the name of my parents, Chinni Chetti Nanjamma, and we used to we conducted one health camp there and a workshop along with the cardiologists.
Great. And this is again a conference where Pinamani Nageshwara sir is there and yourself are there.
On the occasion of inauguration of the Lithotripsy Center. Yeah.
Your Lithotripsy Center. That is, I think, this is a very wonderful photo where Mahesh Desai sir is there, where Ganesh Gopal Kishan sir very young look. I can see you are there in the center. And
SIU Canada. You can see Dr. S.V. Kandasamy there.
Yes, sir.
Dr. Bapat, and then myself, Nageshwara Rao, Dr. Patel, Snehal Patel.
Yes, sir.
Dr. Ganesh Gopalakrishnan.
Yeah.
This is Patel's wife. This is Dr. Kandasamy's wife. This is Dr. Mahesh Desai's wife. These are the people.
Yes, sir.
I'm in that conference. How many years do you remember?
This is which year, sir?
I don't remember. Many years ago.
25 years back.
Yeah. And this is the Urology Society of India. I think it is written maybe to 10th or 19th annual conference, I think it is, Ooty, Tamil Nadu, 1985.
This was a unique conference in the sense we had an annual conference at Ooty.
Yeah.
The conference used to be in cities only. We wanted to have good surrounding, and this was enjoyed by all people. It's the most enjoyable conference many people had. Visiting a hill station, at the same time, very good meeting.
Very good. Who was the organizing secretary?
Organizing secretary was Dr. Ashok Kumar, C.L. Ashok Kumar, professor in Madurai. See, this was attended by Dr. Khalid Bhatt, who did a transplant for Dr. M.G. Ramachandran. This is Khalid Bhatt. This is our health minister, and this is Colonel Rautre, who was my successor.
Yeah. Fantastic. Great memory. This is great memory. This is again lithotripsy center at inauguration at Tamil Nadu Urology Research Center Private Limited. That is, this is your first lithotripsy mission.
Lithotripsy machine. You see, at that time, lithotripsy was considered to be a very, very costly affair and cannot be afforded by the many people, and it was not accessible for poor people also. We bought this machine, we organized it, and we slashed the cost from half of what they were charging in other places. So very popular. The unit, not the unit, the department is still running very well.
This is again inauguration, I think.
Inaugurated by one Gopalakrishnan, who was chairman of the Indian Bank, who came forward to advance our finance project. And so
Great.
many others refused.
This is again Ooty conference. Thank you. I am stop sharing. You have excellent memory, sir. You have excellent memory. My God, memory. I think that is the secret for your health. And what about? We have not shared about your brother has put a message, Natarajan sir, that we are watching. Very happy for watching my brother talking on this program. I have given to all your relatives and including my father. And what about your wife, sir? She is from which place? Is it arranged marriage or love marriage?
The love is always there because arranged marriage, and they are related people from Salem town itself, area called Shavapet. We lived in Tugai, the other area is Shavapet. He was from there.
Madam was madam is housemaker or professional? Your wife?
Housemaker, yeah.
Yeah.
Professionally, that she is having some social work. She is organized along with her friends old age home, which she has been the president for a number of years, still looking after that. So many
I think majority of the credit goes when some successful person like you, who have dedicated most of the time spending hours in the hospital, like Ramesh sir said, they have. Do you think that they have sacrificed a lot for you, especially your wife?
Well, you must have a good support at home to carry on work at other places. If you have a wife who will look after the house well, you can do surgery peacefully. That is very important.
Sir, I will ask quick questions, 10 questions, and then we will conclude the session by giving few minutes to Venugopal sir, who is very interested to share the screen. Quick questions, one answer. Number one, do you get anger on the staff and throw the objects in the operation theatre, or you are a cool man? Ramesh sir, you should correct if he is wrong.
I should not say, but I don't throw instruments. But I do get upset if they do any big silly mistakes. But otherwise, in the theatre, I don't throw instruments at the system.
Second, yes sir, tell sir, Ramesh sir.
Many of the colleagues don't believe that he can lose his temper at all.
Don't believe.
Don't believe that he can lose his temper or get angry.
He does get anger.
Yeah,
Very rarely, but he doesn't show it or he will not throw a tantrum. Just going away.
Among all the children, whom you used to like more? Silly question.
Daughter.
Daughter?
The daughter.
Only one daughter is there?
She's away
Yes.
for more than 50 years, but still.
You like her? That is the beauty of Indian culture. That daughters always like fathers and fathers always like daughters. Even though somebody else has urology and taking your chair, also you like your daughter only. And when do you get sleepless nights? If any patient gets complication, he is in morbidity range. Do you feel guilty and you don't sleep on that night? When do you feel really depressed in your professional career? Or if you cannot present some case, When do you get depressed? No, never.
I do get upset if patients are not doing very well post-operatively, particularly if any unexpected turns happen. At that time, I will be restless. I will try to go and sleep as early as possible the next day. Sleep do get disturbed. Nowadays, of course, I don't do any major surgery. Ramesh takes up all the burden. It is still worrying. You don't want to see operative patients. That is the general morale of, idea of any surgeon.
Yeah. So we always seen you with a little healthy, chubby person in all the photos. Do you never believed in less weight, six packs, protein diet, and controlling diet and doing exercise daily? Do you do exercise daily?
Only exercise I do is walking.
In your peak career, do you used to do exercise or directly go to work?
Direct go to work. So the student days I used to play tennis and
Not,
badminton.
after that, not.
Starting the practice, there was no time for this. But later in the years, I used to do evening walk.
What is the suggestion you want to give to younger generation in relation to the surgical techniques, in relation to the money earning, in relation to the happiness, and in relation to the social life? What is the advice you give?
Money earning should not be the main aim. It is necessary, but that should not decide about your decision. Don't do any surgical work just to gain money. And don't do any procedure with which you are not very familiar. You try to get somebody with experience to help you at least few cases. Then you can start on your own if you are doing any procedure.
Do you think that the subspecialties will develop sooner and you have to focus more only on subspecialty as soon as MCH urology is over?
Definitely subspecialties would come up. My main this thing for so many years I have been telling urology should stop to be a specialty. It should be a general function. You must do straight away after MBBS urology for 5 years. At that time, the fourth and fifth year, we can take up specialties. Doing general surgery MS is a waste of time, waste of academic year.
Okay.
Straight away after MBBS, take 5 or even 6 years of MCH urology course. That is the best way to improve urology.
Very good suggestion. In fact, I don't know how far it is applicable, but yes, you should consider the time should not be wasted, and lot of the abroad training is that focus on what you want, enter with the professor, train with the professor, practice the same rest of the life. Other surgeries we should not practice much so that the yield will be good. And in the present family in your house, along with you, you stay with your son.
I live with my father.
Yeah, Ramesh, you should come onto the screen in the last moment. Say hello to the audience. Your father has been a great father figure, and hi, Ramesh, sir.
Yes,
So,
okay.
a few moments with your father. He was a strict father. He forced you to become a urologist or nothing like that.
He did not force me to become a urologist. Of course, he was a big. Even by the school, approaching college, all my relatives, my father, everybody become a doctor. Not just a doctor. You become a doctor and help your father in his practice. This is the advice which was during my childhood days. That's how it, and I still feel that I'm only assisting my father in practice. After now what I'm in urology practice for 30 years now, almost 30 years, and
Great.
that's what
Great.
I feel that I'm
Yeah. I hope you ever felt why you have joined urology. You are enjoying your life. I have seen you happily moving around and talking to people and enjoying the life. You feel happy for the decision which your father helped you to become. Father helped to think about urology.
Oh yes, is the thing. I met Professor H.S. Butt during the urology conference in Ooty. That's the first time I met her. And I was introduced to him, and then Dr. Butt told me, Ramesh, you should become a urologist. This is the only specialty where you can use all your five senses. You can
Yes.
see the flow, you can hear the urine flow, you can taste it, you can touch it. So he said, that's how he said and recommended to take up urology. And
One
of
of
course,
the
to have a very senior man who's very much respected in the profession and in the society, it becomes that much more easier and to convince you to take up that profession line.
Great, sir. So, Vijay Kumar Agarwal, he said that I'm very happy to say that Dr. Chinnaswamy sir was my examiner at JIPMER, March 1989. He has put in the message. So, with this, I felt very happy that this was a long time dream. As a professor who has influenced my early career of entering into surgery through my father. I always remember that moment we waited in Vijay Hospital. You have spent 15 minutes. That time only you offered coffee and you advised that surgery has something a great charm and you go to surgery. If you want to concentrate on pediatrics, you become a pediatric surgeon. Thank you very much, sir, for making many of the younger urologists to learn, become students under you. You are still very active and your memory is very good. Everybody must follow people like you who have dedicated their lives to urology. So before I conclude my session, I will ask Professor P. Venugopal, who was very happy to join. For last 2 days, he asked, can I join? Can you give the Zoom link? He is active in social media. So he will say a few comments about Chinnaswamy sir. Venugopal sir, over to you.
Can you hear me?
Yes, sir.
Venu,
First of all, let me congratulate you, Chandramohan, for
Yes, sir.
making this possible. I think as a new year starts in pure urology, you found the apt person to talk about urology. For him, it's about almost 6 decades of urology that he has been practicing. He was 1 year senior to me for MCH urology, but that's all past long, the past history. The most important thing that I appreciate him is his humbleness, his sincerity, and he is always available to help others. These qualities are very rare, are becoming rarer nowadays. Everyone is more inclined towards how to make their own life easier and cozier than trying to help others. Chinnaswamy, on the other hand, has helped all of us immensely during our formative years. In 1966, when I joined MCH Urology, we had to go to Madras urology department for 1 month and stay there for 1 month and learn a lot of urology, what they are practicing. And they used to come 1 month to CMC value and see how we are practicing urology. This was like an exchange program. And when we went to Madras, we were greatly benefited by the numbers of cases. I mean, if you want to do, say, pyeloplasty, hydrophorosis, there will be 10 or 12 in the ward available. Or if you want to say a carcinoma of kidney, maybe 2 or 3 will be available. So the wealth of material that they had was something that we learned more because we could go there. Ours are private setup in CMC, so patient had to pay. But in Madras Medical College, it was free for all, and they had a large number of cases. Now today, I don't think you can expect a particular hospital to have such large variety of cases. Now, coming back to Professor Chinnaswamy, I think my association with him is almost 5.5 decades now, and we have been very, very close and intimate. Yes, we had our little bickerings every now and then on association matters, not personal matters. Personally, we were very, very close, and I feel he's more like a elder brother to me. Not elder, more like my elder brother only. He's very, very affectionate. And today, we all miss Dr. Ravichandra, we miss Dr. Raghunath, and these are the four of us we called at one time as the 4 musketeers of urology. I think this was when we were at our top, society-wise. I think I don't want to waste more time talking about Chinnaswamy because I can go on and on and on, talk about Chinnaswamy, what Chinnaswamy doesn't know. When I got more information of Chinnaswamy and our being together, I think Chinnaswamy has helped us a lot. And God bless him, and he should be there with us for a long, long time. Thank you, Chinna.
Thank you, yes. Thank you very much, sir, Professor Venko, sir. That's a crisp message. And thank you, Ramesh, sir, for helping your father. Really appreciate that. Chinnaswamy, sir, we all need your blessings, and you have been a great person. And I hope you will live for long time with your great heart and open-mindedness. Wish you all the best and further great health. We pray the God that you will be given all the help to watch as much as urology possible in your life. Thank you very much, sir.
Chandramohan, try your best to make urology as a general specialty straight
Sir.
5 or 6 years course.
Great.
Stop the necessary.
Yes, sir.
Things are doing so well.
Mere waste of time. Great, sir. I will definitely keep in mind. I am in private practice. Let me try. Thank you very much, sir. Chinnaswamy, sir. Thank you, Venugopal, sir.
You are going to be president of Urology Society one of these years. Soon enough.
No, sir. I'm council member also. I am not. See, main idea is, sir, I always feel that the seniors have to be revisited in their life, because one after few days I will also become senior. Then your experiences, for example, this YouTube link will be there forever. Those who wanted to see and listen what has happened, those photos which you have sent, there will be a great memory. And the technology has changed. Now YouTube link will be there forever. So we are very happy to keep these memories. I am fond of it. Fortunately, it is my private program. So whatever I like, I can do it, which is good for the society. Thank you very much for giving this opportunity, sir. We will conclude the session. Thank you, sir.